Mr. Menendez. My name is Elizabeth Saloma, and I will be your student nurse today. I'm just going to go ahead and get some hand hygiene, some hand sanitizer, clean my hands, and then I'm going to don some gloves. Okay, and can you just go ahead and tell me your name and date of birth?
Mr. Menendez, May 2nd, 1995.
Okay, and I'm just going to check that with your wristband and make sure it matches, and also the MRN number, which they match what's in the chart. And I'm going to go over your allergies with you. Do you have any allergies to medications?
Nope.
Food?
Nope.
Latex?
Nope.
Environment?
Nope.
Tape?
Nope.
Okay, and that matches what's on your allergy bracelet to our chart, so that is good. I'm next going to go over your vital signs with you. Your blood pressure was 118/62, which is normal. Your heart rate was 68 beats per minute, that's normal. Your respiration rate is 17, that's normal. O2 99%, which is normal, and your temperature was 98.7, which is normal. So what brought you in today?
I have pain in my leg.
Pain in your leg. And when did it start?
2 days ago.
2 days ago? And you said it's pain in your leg, like up on your thigh, the right leg?
Yes. Right.
Okay. And can you describe the pain to me?
Pinching.
Pinching? And does anything make it worse?
Walking.
Anything make it better?
Resting it.
And have you done any treatments, like any medications or icing?
Ice pack.
Ice pack? And on a scale of 0 to 10, with 10 being the worst pain of your life, can you rate the pain for me?
4.
A 4? Okay, so I'm going to go ahead and put that information into your chart. And next, I'm going to go over your level of consciousness. So you already told me your name. Can you tell me where we are?
USA.
Can you tell me what time it is?
2:30.
2:30. And just by looking at the patient, she's symmetrical, and she does not appear to be in any distress. And so the patient is alert and orientated ×3 to person, place, and time. Next, I'm going to move on and check her equipment. And so I'm going to check her nasal cannula. Is it comfortable?
Yes.
I don't note any skin breakdown, which is good. I'm just going to check the tubing. There's no kinking. I'm going to check what's being given to what's in our chart, which is 2 liters via nasal cannula. That matches. Next, I'm going to check your IV. Is there any tenderness?
No.
No tenderness. I don't note any edema or erythema. I'm going to check the tubing. There's no kinks in the tubing. Check what's being given, which is 0.9% sodium chloride, normal saline at 100 milliliters per hour, so that matches what's the provider's orders. So that is good. And then the patient does not have a urinary catheter present, but if there were one, I would assess accordingly. Moving on, I'm going to check the hair, skin, and nails. So checking the hair is clean and neat. Checking the scalp, there's no skin breakdown, no rashes or lesions. That's good. Just checking the skin, down the legs. The skin appears to be warm, pink, soft, and dry. I don't see any rashes, any lesions, any skin breakdown. Do you have any wounds that I'm not aware of?
Nope.
Okay, so I don't need to do any dressings or check for drainage. And then I'm going to check skin turgor. That's good. So it's less than 1 second. Rebound on each hand. And then I'm going to check capillary refill time on each finger. And then on each toe. And that's less than 3 seconds, which is normal. Next, I'm going to and then also I don't note any edema in the extremities, so that's good. And then I will be moving on to assessing HEENT. So I'll check your ears, check the back. I don't note any drainage and no skin breakdown, which is normal. Can you put your hands up to the bridge of your nose? I'm going to check your pupillary response. This side. Okay. And then can you follow my finger to your nose? And then follow my finger one more time. Okay. So the pupils are frilla. Their pupils are equal, round, reactive to light and accommodation. Can you pull your eyes down for me? The conjunctiva is pink and moist, and the sclera is white, so that's good. Next, just going to check your nose. The nasal passages are pink and moist. I'm going to check your mouth. I don't note any lesions. Can you say ah for me? Your uvula is at midline, so that's normal. And then can you smile for me? So the smile is symmetrical. And then moving on to respiratory. Just by looking at my patient, she is not using any accessory muscle use, and she doesn't have labored breathing. Next, I will go and auscultate lung sounds. So every time my stethoscope touches your skin, can you take a deep breath for me?
I want to see like the shape.
Thank you. Okay. So lung sounds are clear and equal bilaterally. I would, in the clinical setting, have the patient wear the gown so that I would be able to listen on skin for better lung sounds. And then I would teach the patient how to use a spirometer, and I would have them demonstrate use accordingly. And then moving on to cardiac. So I would first palpate the carotid on each side. And the carotid pulse is strong and equal bilaterally and no frills noted. I would then palpate the radial pulses on each wrist. Those are strong and equal bilaterally, 2+ rating. I would also do pedal pulses on each foot, and those are strong and equal bilaterally and 2+ as well. And then I would palpate the PMI at the 5th intercostal space, the midclavicular line, and I would note no lifts or heaves. Yes. And then moving on, I would auscultate lung sounds. I would do the aortic at the 2nd intercostal space, right sternal border, and then I'll go over to the the pulmonic on the second intercostal space, left sternal border, and then I would go to the herbs, which is the third intercostal space, left sternal border, and then I would do the tricuspid, which is the fourth intercostal space, left sternal border, and then I would, for these purposes, just verbalize that I would also check the mitral at the fifth intercostal space, mid-clavicular line. And then I would go ahead and auscultate with my bell first. Okay, so I've already checked the top right for the aortic, and then the top left for the pulmonic, and then I'm going to check the ERMS, and then the tricuspid, and then I would also listen to the mitral, and then I would listen with the diaphragm, and I would check the aortic, and then the pulmonic, and then ERMS, and then the tricuspid, and then the mitral. And lung sounds are equal bilaterally, and I can hear the S1 and S2 sounds. And I don't note any extra sounds. And then also I'll go back to when next I would auscultate the carotid on each side, and hold your breath for me. Okay, and then hold your breath again. And then I don't note any bruits, so that's good. And then I would go on to assess the musculoskeletal and extremities, just by looking at my patient. I would ask them, are you experiencing any swelling, numbness, or tingling?
Nope.
Okay, and then I would have them do the hand grip test, and then pull me towards you, pull me away, push away from me, and then I would have them push down on my hands, and then push up on my hands. So the hand grip and the foot strength test is 5 out of 5, which is good. And then I would then make sure that my patient's call light is within reach, and that they know how to use it. And then I would have the bed in the lowest settings with the hand railings accordingly due to provider's orders. And then I would, is there anything else I can help you with? And then I would perform hand